Welcome back. On the heels of several tragic cases of neglect, abuse, even the deaths of children in South Florida, the governor is now proposing cuts and significant layoffs to DCF. And Mo, I wanted to ask you, especially with the report that just came out on the death of Nubia Barahona, taking that into account, what do you think this is going to mean for the safety of children in state custody?
The proposed cuts to DCF are probably the most unkindest cuts of all. You have $179 million being proposed to be cut, 1,850 positions from DCF. DCF provides safety net for the most vulnerable of our children and families. You cut back on child protection teams by 25%. You reduce funding for family preservation support services. You make it harder to get mental health and substance abuse treatment for families who are desperate and want it. And you begin to pull at that very porous safety net that we have, and children are going to fall through it. And I think it's very dangerous.
And this report talks about the need to retain quality people, investigators, caseworkers. Commissioner, when you cut, that's one of the things that you risk, is losing quality people.
Absolutely, because you can only survive on so much. They have to think about their families as well. But what we're doing, we're putting the community, we're putting children at risk. We're putting families at risk. When you think about the cuts to education and now the cuts that are being proposed with DCF, it's unconscionable to even think of what could happen to a child. If we thought we had a problem before in terms of follow-up, being able to go to those homes and visit those homes to make sure that children are being kept safe, it's going to be even more devastating.
And you think these cases, so much publicity, you think it's going to make a difference in Tallahassee?
I would hope that it would make a difference. I know that it makes a difference with our advocacy, and we have to make sure that we're pulling the community together, that we're going up to all of our elected officials, all of our legislators, all of our House of Representatives, and senators, to make sure that they get the message that these cuts cannot happen to DCF.
Mo, you think this is going to have an impact?
I hope that cooler heads will prevail. One of the things that comes out of the report is the pay of Child Protective Services investigators, $17 an hour, a turnover rate of 42%, so that over a year you have fewer than 58 out of 103 protective service investigators.
And that's part of the
And so it's a constant turnover you have.
And well, that's not the only change on the horizon. There are other changes. As you know, right now, voluntary pre-K is available to all 4-year-olds in Florida, but some state legislators are floating the idea of a constitutional amendment that would make it available only to kids whose families meet a certain income level. We touched on it just a little bit a few minutes ago. Blythe, the Early Learning Coalition, actually is in charge of VPK. What's your take on this?
You know, we know that a lot of families use the VPK program, and we want it to be available to all families regardless of income and socioeconomic status. It's important that all 4-year-olds have an opportunity to have a quality pre-K experience, and so we want to make sure that that continues.
What do you think will happen if there's a cutoff?
You know, if there's a cutoff, we are running the risk of leaving some children behind who will not have a pre-K, a quality pre-K experience, and then they're showing up to kindergarten without those early education experiences. And again, it speaks to being left behind and not being prepared for the school success that they'll need.
And the cycle begins.
ILEANA, if I may, I think also what it does, we can teach children at a very early age in terms of blending the socioeconomic conditions. And when you are not able to do that, if you're going to restrict it to just one income group, we're not teaching them the kind of socialization that they can start at a very early age.
Well, we'll certainly see what happens in the coming weeks. We want to thank all of you for being with us this morning. And we're going to stick around for a little bit more. So up next, the latest on Medicaid reform bill, and also access to KidCare. We'll be right back.